Hello everyone, this is Dr. Jawad from Total Health and Wellness Center. What I want to talk about today is vitamin D deficiency. Now, a lot of my patients, when they do blood work with me, I want to find out where their vitamin D levels are because it's a very, very important vitamin. Actually, it's not even a vitamin, it is a prohormone that is converted to hormone form through the liver and the kidney. Also, we get vitamin D produced in the skin exposed to sunlight specifically, and also it's found in foods. Now, there's many different types of there's many forms of vitamin D. I want to specifically go through what's called vitamin D3. So there's two major forms, vitamin D2, which is called ergocalciferol, and then there's vitamin D3, which is called cholecalciferol. And you can see here, when we're exposed to the sunlight, it's actually converted through the liver and the kidney function. So there's many functions of vitamin D. It regulates calcium and phosphorus levels in the blood by promoting their absorption from the food into the intestines. Also, it promotes bone formation and mineralization. It also inhibits the parathyroid hormone secretion from the parathyroid gland. Also, it affects the immune system by promoting immunosuppression, phagocytosis, and anti-tumor activity. So you can see the function of vitamin D is very, very essential to the way our body, our regular body homeostasis is performing. So where do we get vitamin D? Many dietary sources: fatty fish, cod liver oil, mackerel, salmon, beef liver, egg yolk. Now, there's a lot of controversy about throwing out the yolk and only having the egg whites. I used to do that myself until I realized how much nutrients are in the yolk. So what I do, I don't throw away the yolks anymore. I actually eat the yolks because I want to get the essential vitamins like lutein for the eyes and especially D3 for my system. So eat your yolk. Also too, grass-fed butter. Infants, they absorb the vitamin D supplement from the mother's milk. So again, there's many different dietary sources of vitamin D. So why does D deficiency occur? First and foremost, because nowadays we're not going out in the sunlight that much as we used to back in the days. So inadequate sunlight exposure, mainly because we live in the northern states. If you lived in the coast states or next to the equator, you're going to get more vitamin D3 naturally through the exposure through the skin. Poor access to micronutrient-rich foods. Now, the soil is not nutrient dense anymore, so even if we want to, we have a hard time obtaining adequate amounts of vitamin D3 through our foods. Or poor digestion. Vitamin D3, it's a fat-soluble vitamin, which that basically means it has to be broken down by bile, okay, bile stored in the gallbladder, once it enters the small intestines. That's where we absorb all the fat-soluble vitamins, especially vitamin D. So if you have a poor small intestine or inflammation, which is called small intestinal bacterial overgrowth, you're not getting the adequate absorption of vitamin D3 into your system. And or if you have Crohn's disease, also have colitis, leaky gut due to excessive amounts of gluten, your body's not absorbing the amount of vitamin D3 that it should be absorbing due to poor digestion. Also, obesity. Now, it's extracted from the blood by the fat cells, so the more adipose tissue that you have on your body, you're absorbing less vitamin D3. Also too, impaired conversion. Now remember, in the beginning, it converts to active form of vitamin D3 through the liver and through the kidney. So into active metabolites, the kidney converts vitamin D to active form 1,25-dihydroxycholecalciferol. So if you have poor liver function and poor kidney function, you're not going to be absorbing adequate amount of vitamin D3, which will lead to deficiency. Now, what does this feel like? What's the symptoms? Depression, anxiety, unexplained fatigue and muscle weakness, weakened immune system, chronic kidney disease, bone weakness. Now in kids, it's a form called rickets. In adults, it's a form called osteoporosis. Hormone imbalance. Remember, vitamin D3 is a prohormone. That means it makes hormones. So if you have a deficiency of vitamin D3, you're going to have hormone imbalances. And this is for guys, for girls, it's your testosterones, it's your estrogens, it's your progesterones, it's your estradiols, because D3 is needed to make those. Also too, diabetes. So lack of vitamin D interferes with insulin secretion. So what you're doing, you're just worsening your diabetic state. So once you're getting adequate forms of vitamin D3, what is that going to improve? How is that going to feel like? Well, your immune system is going to be increased. Your metabolism is going to be better. Hormone production is going to be up. Thyroid and adrenals are going to start to work better because they need vitamin D3 for it to be active. Your overall mood and your bone strength is going to be better just by increasing the levels of vitamin D3 in your system. So, most important, how do we diagnose your D3 content, the level in your blood? When patients come to me with a full comprehensive blood panel, one of the things I'm looking for is the vitamin D3 marker. And that's 25 hydroxy vitamin D or 250 OHD, which the OH stands for hydroxyl and D is vitamin D. So this is a very, very important blood test that I look for in blood exams, and or if you're coming to my clinic, I do this with every patient. So the vitamin D deficiency diagnosis. Now, basically the number is the higher the better. Anything above 50, 60, 75 nanomoles per liter is perfect. But I see a lot of people hovering around less than 25. So you're deficient. So what you're going to symptoms, you're going to lead to rickets or osteomalacia. Again, poor bone strength. Anything between 25 to 50 nanomoles per liter is still insufficient. So you're still at risk of disease. I'm looking for anything above 50, anything above 70, because that's going to be healthy lifestyle advice, so forth and so on. So you're going to be, so that's what I'm looking for, okay? So when you have low vitamin D levels, or you want to just get it up there, some treatments, very important, natural or artificial light are effective therapeutically, but oral administration is preferred, especially because we live in the northern states. If we lived in California, go out in the sun, 20 to 30 minutes every single day, you want to have more skin exposure, the better, okay? Increased vitamin D consumption through the diet. You can always take it through wild-caught salmon or fish is the #1 way to increase your vitamin D levels. What I always recommend is taking high-quality vitamin D supplementation in capsule or liquid form. Now the question is always, what is the dosage of vitamin D3 I should be taking? I hear from a lot of my patients, their practitioners, has them on 1,000 to 2,000 international units of vitamin D3 daily. That is just bad. That is just not enough, especially if you're on medications, which is bogging up the liver and kidney. If you're carrying excessive amount of body fat, remember the obese tissue, that adipose tissue, acts as a blockade for absorption. If you have poor digestion, if you have small intestine bacterial overgrowth, if you have Crohn's disease, if you have leaky gut because you're eating large amounts of gluten or wheat, you're not absorbing D3 as it should. So the rule of thumb is take it with some healthy fat like, again, coconut oil or something like that, because there's a fat-soluble vitamin. So the dosage is 1,000 IUs per 25 pounds of body weight, which that means is 4,000 IUs if you're 100 pounds, 8,000 IUs if you're 200 pounds, 10,000 IUs if you're 250 pounds. Rule of thumb, what I always recommend to my patients is off the cuff, take anywhere from 8,000 to 10,000 IUs of vitamin D3 daily, because you want to get that up in your system. Now, there is running a risk of taking too much vitamin D, and that's called vitamin D toxicity. It's a very rare condition, but yes, it can happen. It's usually caused by megadoses of vitamin D supplements. I've had patients come to me from their other doctors, and they're taking 50,000 IUs of vitamin D3 daily. Yeah, they're running the risk of vitamin D toxicity. So the consequence of vitamin D toxicity is a buildup of calcium in your blood, which is called hypercalcemia. And I'll go over that in a different video. So what happens when you have vitamin D toxicity? You have poor appetite, nausea, vomiting, weakness, frequent urination, and kidney problems. This is signs that you have vitamin D toxicity. It is a rare symptom, but it can happen. So if it does happen, just stop taking the excessive amounts of vitamin D and let those levels go down. Okay, if you feel like that you're curious about your vitamin D levels or found this video useful, please share with a friend. Call my office for a free consultation. My website is www.totalhealthdepage.com. My phone number is 630-653-2225. And thanks for watching. Thank you.